As we grow older, many changes take place within our bodies, some subtle and some more noticeable, and one of the most overlooked yet common issues among seniors is the persistent feeling of dryness in the eyes. This condition, often dismissed as a minor inconvenience, can significantly impact daily comfort, focus, and even vision clarity. The eyes, delicate and complex organs, rely on a consistent layer of moisture to stay healthy, clear, and pain-free. When this moisture becomes insufficient, irritation begins, followed by itching, burning, redness, and a gritty feeling, as if sand were lodged in the eyes. Dry eyes in old age are not just about discomfort. They are a signal, a quiet warning that something fundamental has shifted. The glands that produce tears may slow down, the hormones that once maintained balance may decline, and environmental exposures that once went unnoticed may now leave a lasting effect. Aging also brings with it medications and conditions that quietly steal moisture from the eyes, leaving them exposed, vulnerable, and tired. Reading becomes a chore, screens become unbearable, and even a simple walk in the wind may bring discomfort. Despite its prevalence, dry eye is often underdiagnosed and misunderstood, especially in seniors who may assume it's simply part of aging. But with awareness, natural remedies, and simple lifestyle changes, this condition can be managed, and relief can be achieved without the constant need for artificial drops. The goal is not just to treat the symptom, but to understand its root causes, to nourish the body from within, and to protect the eyes naturally. In the gentle pursuit of lasting comfort, the eyes can once again find clarity, peace, and rest, even in the golden years. The journey begins with knowledge, and the first step is understanding why the eyes go dry with age. Let's see the reason for eye dryness first. 1. Reduced tear production due to aging of the lacrimal glands. As people grow older, the lacrimal glands, which are responsible for producing the watery layer of the tear film, gradually begin to lose their function. These glands are small, almond-shaped structures located above each eyeball, and their role is to create tears that keep the eyes moist, clean, and comfortable. With age, these glands often become less active. The tissues within the glands may shrink, blood flow may decrease, and cell repair may slow down. This natural aging process reduces the amount of fluid released onto the surface of the eyes. Tears are not just water. They also contain proteins, enzymes, and oils that help protect and nourish the eyes. When fewer tears are produced, the surface of the eye becomes dry. This dryness leads to symptoms like itching, burning, redness, and sensitivity to light. Sometimes the eyes may even water more as a reflex, but this extra moisture is often poor in quality and does not relieve the dryness. Environmental factors, such as air pollution or dry indoor air, can make the situation worse. In older adults, the decline in tear production is often slow and unnoticed until the dryness becomes irritating or painful. Activities like reading, driving, or watching television can increase the discomfort, as blinking becomes less frequent and the eyes become even drier. Reduced tear production is one of the main reasons seniors suffer from dry eyes. It is a gradual process, and though it cannot be fully reversed, it can be managed. Identifying this as a natural change allows for early treatment, better comfort, and improved eye health. Understanding this cause is the first step in recognizing the importance of eye care in the later stages of life. 2. Hormonal changes, especially after menopause in women. Hormonal changes, particularly in women after menopause, play a major role in causing dry eyes in old age. Hormones regulate many body functions, and the eyes are no exception. Estrogen and androgens, which are sex hormones, help control the quality and quantity of tears. When hormone levels begin to decline with age, the glands that produce tears and oils for the eyes start functioning less efficiently. This decline affects both the lacrimal glands, which produce the watery part of tears, and the meibomian glands, which release the oily layer that keeps tears from evaporating. During menopause, estrogen levels drop significantly, and this shift can disturb the natural balance of tear production. Some studies have shown that lower androgen levels also reduce the oily secretion that helps keep the eyes moist. Without enough oil, the tears evaporate too quickly, leading to dry, irritated eyes. In many older women, this results in a condition known as evaporative dry eye, which feels like burning, stinging, or itching. These symptoms may worsen at night or during long hours of reading or screen time. In men, hormone levels also decline with age, but the process is more gradual. As a result, men can experience dry eyes too, but often later in life. Other health conditions like thyroid problems or autoimmune diseases may combine with hormonal changes and make dry eye symptoms worse. Since hormonal changes are natural and unavoidable, it is important to manage their effects through proper care. This includes using warm compresses, increasing omega-3 intake, and protecting the eyes from dryness. Recognizing the link between hormones and eye health helps seniors, especially women, take better steps toward relief and long-term comfort. 3. Use of medications like antihistamines, diuretics, and antidepressants. As people age, they are more likely to be prescribed medications for various health conditions. While these medicines help manage serious issues like high blood pressure, depression, or allergies, they often come with side effects. One of the most common and overlooked side effects in seniors is dry eyes. Certain medications, especially antihistamines, diuretics, and antidepressants, can interfere with the body's natural ability to produce tears. Antihistamines are often taken to relieve symptoms of allergies, such as sneezing, itching, and runny nose. However, these drugs also reduce secretions in other parts of the body, including the eyes. They can quickly dry out the tear film, leaving the eyes feeling gritty and irritated. Diuretics, commonly used to treat high blood pressure or fluid retention, work by helping the body release excess water. Unfortunately, they may also dehydrate other tissues, including the eyes. With less water available, tear production drops, and the surface of the eye becomes dry and uncomfortable. Antidepressants, especially those that affect the nervous system, can also reduce tear secretion. These drugs often alter the balance of chemicals in the brain, which in turn affects how the nerves signal the tear glands. This leads to fewer tears and poor eye lubrication. Older adults often take multiple medications, a condition known as polypharmacy. When several dry eye-causing drugs are taken together, the effects can add up quickly. Seniors may not always connect their eye symptoms to their medications, making the problem harder to identify. Understanding how medications affect the eyes helps in finding better solutions. Doctors may adjust doses, suggest alternatives, or recommend natural eye care methods. Awareness is key, and by recognizing medication as a possible cause, seniors can take steps to protect their eye comfort and vision. 4. Medical conditions such as diabetes, rheumatoid arthritis, or thyroid disorders. Certain medical conditions, which become more common with age, can directly affect the eyes and lead to dry eye symptoms. Among the most notable are diabetes, rheumatoid arthritis, and thyroid disorders. These illnesses do not just affect the major organs or joints. They also interfere with the body's ability to maintain moisture and protect sensitive tissues, including the eyes. Diabetes, whether type 1 or type 2, can damage the small nerves that control tear production. Over time, high blood sugar levels can reduce the function of the lacrimal glands, making them produce fewer tears. Diabetics may also experience slower wound healing and greater inflammation, both of which can worsen dry eye symptoms. Blurry vision, frequent blinking, and irritation often follow. Rheumatoid arthritis, an autoimmune disease, causes inflammation in the joints, but it can also affect the eyes. In this condition, the immune system mistakenly attacks healthy tissues, including the glands that produce tears. As a result, tear production falls, and chronic inflammation may develop on the surface of the eyes. Many people with this disease experience a condition called secondary Sjogren's syndrome, where both dry eyes and dry mouth are present. Thyroid disorders, particularly hyperthyroidism and Graves' disease, can change the structure and function of the eyelids. In some cases, the eyelids may not close fully, which exposes the eye surface and allows moisture to evaporate too quickly. This constant exposure leads to dryness, irritation, and even damage to the cornea if left untreated. When seniors are diagnosed with these conditions, it is important to consider their impact on eye health. Treating the underlying disease helps, but additional care for the eyes is often needed. Regular checkups, proper hydration, and targeted natural remedies can all support comfort and vision over time. 5. Eyelid issues like incomplete blinking or drooping lids, ectropion. As the body ages, the skin and muscles around the eyes can weaken and lose elasticity. This natural decline often leads to eyelid problems that directly affect tear distribution and retention. One common issue in seniors is incomplete blinking. Blinking is essential for spreading tears evenly across the surface of the eye. Each blink refreshes the tear film, removes dust, and helps prevent dryness. When blinking becomes slow, shallow, or incomplete, parts of the eye remain exposed. This exposure allows tears to evaporate faster and leads to dry, irritated eyes. Another problem is drooping eyelids, a condition called ectropion. In ectropion, the lower eyelid turns outward and sags away from the eyeball. This condition prevents tears from staying on the eye's surface and often causes them to drain away too quickly. Without a proper tear layer, the eye becomes dry, red, and sensitive. Seniors with ectropion may also feel that something is always in their eye, and they may rub it more often, which increases irritation. Both incomplete blinking and ectropion often go unnoticed in the early stages. However, over time, they can significantly worsen dry eye symptoms. These problems may be caused by natural aging, facial nerve weakness, previous eye surgery, or long-term sun exposure. In some cases, medications that affect the muscles can also contribute. Proper treatment often depends on the severity of the condition. Mild cases may respond well to eye lubricants, warm compresses, and eyelid massage. More serious cases, especially ectropion, may require minor surgical correction to restore normal lid function. Understanding the role of eyelids in maintaining moisture is essential. Healthy blinking and proper eyelid positioning protect the eyes and help seniors maintain better comfort and clearer vision throughout the day. 6. Decreased blink rate, especially during reading or screen use. Blinking plays a crucial role in keeping the eyes moist and comfortable. Each time a person blinks, a fresh layer of tears is spread across the surface of the eyes. This tear film helps remove dust, lubricates the cornea, and protects the eyes from dryness and infection. However, as people age, the frequency of blinking often decreases, particularly during focused tasks like reading, writing, or using digital screens. A reduced blink rate means the tear film is not refreshed as often, which leads to faster evaporation and results in dry, irritated eyes. This issue is common among seniors, especially those who spend long hours reading books, doing puzzles, or watching television. When the eyes are focused on a task, blinking becomes more shallow and less frequent. Instead of a full blink that covers the entire eye, a partial blink may occur, leaving some parts of the eye surface exposed. These areas then dry out quickly, leading to discomfort, redness, or a gritty feeling. Additionally, many seniors wear glasses or use magnifying lenses, which can further encourage prolonged concentration and a lower blink rate. This unintentional behavior contributes to tear film instability, especially if other dry eye factors are already present. Unlike some other causes of dry eye, decreased blinking is often easy to manage with awareness and regular habits. Simple techniques such as blinking exercises, taking breaks during long tasks, and following the 20-20-20 rule, looking 20 feet away for 20 seconds every 20 minutes, can greatly help. Using a humidifier and ensuring proper lighting also reduces the strain on the eyes. By understanding how blinking supports eye moisture and how it naturally declines with age and focus, seniors can make small adjustments that lead to big improvements in comfort and eye health. 7. Chronic inflammation of the tear glands or eyelid margins. Chronic inflammation is a silent but serious contributor to dry eye in older adults. Over time, the glands that produce tears, particularly the lacrimal and meibomian glands, can become inflamed. This inflammation disrupts their normal function and reduces the quality and quantity of tears produced. When the tear film becomes unstable or insufficient, the eye's surface is left dry, irritated, and vulnerable to further damage. One of the most common forms of chronic inflammation related to dry eyes is meibomian gland dysfunction. These small oil-producing glands are located along the edge of the eyelids and are responsible for secreting the lipid, oil, layer of the tear film. This layer prevents rapid evaporation of tears. With age, these glands can become blocked or inflamed, often due to poor eyelid hygiene or changes in hormone levels. As a result, the oily layer becomes thin or absent, and the tears evaporate more quickly than normal. Inflammation can also affect the lacrimal glands, which produce the watery layer of tears. Conditions such as chronic blepharitis, an inflammatory disease of the eyelids, can trigger swelling and dysfunction in these glands. Seniors may experience red, itchy, or swollen eyelid margins, along with flaky debris at the base of the eyelashes. This persistent inflammation may be caused by bacteria, skin conditions like rosacea, or simply age-related changes. It can lead to a cycle where dryness causes inflammation, and inflammation makes dryness worse. Breaking this cycle is essential. Warm compresses, gentle eyelid cleaning, omega-3 fatty acids, and anti-inflammatory foods can help reduce inflammation naturally. Identifying signs early and taking consistent steps to soothe and support the glands can greatly improve comfort. Managing inflammation is not just about temporary relief, but about preserving long-term eye health and tear stability. Now let's see the remedies for this. 1. Warm compresses to unblock meibomian, oil, glands. Warm compresses are one of the most effective and natural remedies for dry eyes, particularly when the root cause is meibomian gland dysfunction. These glands, located along the edge of the eyelids, are responsible for producing the oily layer of the tear film. This oil prevents tears from evaporating too quickly, which is essential for keeping the eyes moist. Over time, the meibomian glands can become clogged, preventing the release of oil and leading to a condition known as evaporative dry eye. To perform a warm compress, simply soak a clean cloth in warm water, ensuring that the temperature is comfortable enough not to cause burns. Wring out the excess water and place the cloth over the closed eyelids for about 5–10 minutes. The heat from the compress helps to soften and loosen the oil that may be blocking the glands. After the compress, gently massage the eyelids in a circular motion to encourage the release of the oil. Using a warm compress regularly can significantly improve tear quality by unblocking the meibomian glands and restoring normal tear production. This helps prevent the rapid evaporation of tears, which is one of the main causes of dry eye symptoms. Additionally, warm compresses can reduce inflammation, soothe irritated eyes, and provide immediate relief from discomfort. For optimal results, it is recommended to use a warm compress at least once or twice a day, especially before bedtime. Seniors who experience persistent dry eyes may also benefit from incorporating this remedy into their daily routine, as it is a gentle, non-invasive way to support eye health and comfort. 2. Using omega-3 fatty acids to improve tear production. Omega-3 fatty acids are essential nutrients that play a crucial role in supporting eye health and alleviating dry eyes. These healthy fats are found in fish like salmon, mackerel, and sardines, as well as in plant-based sources like flax seeds, chia seeds, and walnuts. Omega-3s help to improve the quality of the tear film by promoting the production of the oily layer, which prevents tears from evaporating too quickly. This is particularly important for individuals with evaporative dry eye, a common form of dry eye that results from insufficient oil in the tear film. Studies have shown that omega-3 fatty acids can reduce inflammation in the tear glands, helping them function more efficiently. Inflammation is often a contributing factor to dry eyes, and by reducing it, omega-3s support the natural production of tears and improve overall eye comfort. These fatty acids also help protect the eyes from oxidative stress, which can cause further damage to the delicate tissues around the eyes. To incorporate omega-3s into the diet, seniors can eat fatty fish at least 2 to 3 times a week or take fish oil supplements if they do not consume fish regularly. For those who prefer plant-based options, adding flax seeds or chia seeds to smoothies, salads, or baked goods can provide a good source of omega-3s. If supplements are used, it's important to follow the recommended dosage and consult with a healthcare provider to ensure proper intake. By improving tear production and reducing inflammation, Omega-3 fatty acids can provide long-term relief for dry eye sufferers. Incorporating this remedy into a daily diet can help seniors maintain healthy eyes, reduce dryness, and improve overall eye comfort. 3. Artificial tears or lubricating eye drops. Artificial tears, also known as lubricating eye drops, are one of the most common and immediate remedies for dry eyes. These over-the-counter solutions are designed to mimic the natural tear film, providing moisture to the eyes and reducing the irritation caused by dryness. There are many different types of artificial tears available, ranging from basic lubricating drops to those that contain additional ingredients to help with inflammation or long-lasting moisture. The primary function of artificial tears is to supplement the body's natural tear production when the lacrimal glands are not producing enough moisture. They help to rehydrate the eyes, relieve the burning or gritty feeling, and provide temporary relief from dry eye symptoms. Some eye drops contain preservatives, while others are preservative-free, which can be better for individuals who need to use drops frequently or have sensitive eyes. For seniors, using artificial tears regularly throughout the day can help maintain a comfortable moisture balance. For immediate relief, it's best to use the drops as needed, especially when symptoms such as itching, burning, or redness occur. It's also important to apply the drops before engaging in activities that might strain the eyes, such as reading or using a computer. In addition to the regular use of artificial tears, it's important to choose the right type of eye drop for specific symptoms. Some drops are designed to address mild dryness, while others are formulated to treat more severe conditions or to reduce inflammation. Seniors should consult with an eye care professional to determine which type of artificial tears is most suitable for their individual needs. Using artificial tears consistently can greatly improve comfort, relieve symptoms, and help seniors manage dry eyes effectively. 4. Eyelid hygiene and cleaning to prevent blockages. Maintaining proper eyelid hygiene is an essential remedy for dry eyes, especially when the cause is meibomian gland dysfunction, blepharitis, or other eyelid-related conditions. Regularly cleaning the eyelids can help remove debris, oils, and bacteria that can accumulate around the eyelash line and clog the meibomian glands, which are responsible for producing the oily layer of the tear film. When these glands become blocked or inflamed, tear production becomes impaired, leading to dry, irritated eyes. The first step in eyelid hygiene is to use a gentle, non-irritating cleanser or eyelid wipe specifically designed for eye care. These cleansers are available over the counter and are often recommended by ophthalmologists. The product is applied to a clean washcloth or eyelid wipe, and then gently rubbed along the edges of the eyelids, especially where the eyelashes meet the skin. This helps to remove excess oils, dirt, and any bacteria that may be contributing to inflammation or gland blockages. In addition to cleansers, warm compresses can be used before eyelid cleaning to soften the oils and debris in the glands. The warm compress helps to loosen any hardened oils, making it easier to clean the eyelid area. After using a warm compress, gently massage the eyelids with your fingertips in a circular motion to encourage the release of oils from the meibomian glands. For seniors, practicing eyelid hygiene daily is a simple but effective way to improve tear production, reduce inflammation, and prevent recurring dry eye symptoms. By regularly cleaning the eyelids and promoting the natural function of the meibomian glands, seniors can enjoy better eye comfort and maintain healthier eyes over time. 5. Humidifiers to add moisture to dry indoor air. Dry indoor air is a common environmental factor that can worsen dry eye symptoms, particularly during the colder months when heating systems are in use. Heating systems and air conditioning can significantly reduce the humidity levels inside a home, causing the tear film to evaporate more quickly and leading to dryness, irritation, and discomfort. For seniors who already have dry eyes, using a humidifier in the home can be a highly effective remedy to combat these environmental conditions. A humidifier works by releasing water vapor into the air, which increases the humidity levels and helps prevent moisture from evaporating too quickly from the eyes. By maintaining an optimal level of humidity in the indoor environment, a humidifier ensures that the tear film remains stable and provides much-needed relief from dry eye symptoms. Using a humidifier while sleeping can be particularly beneficial, as it keeps the air moist throughout the night. This is important because the eyes tend to become drier when they are closed for extended periods, such as during sleep. Adding moisture to the air while resting can help prevent the eyes from becoming dry upon waking. It is important to choose a high-quality humidifier and to clean it regularly, as dirty humidifiers can spread bacteria or mold into the air, which can irritate the eyes and respiratory system. Maintaining proper humidity levels in the home not only supports eye health but also improves overall comfort, especially in seniors who may be more sensitive to changes in temperature and moisture. By adding a humidifier to the home, seniors can effectively manage the dry air in their environment and alleviate the discomfort associated with dry eyes. 6. Wearing wraparound sunglasses outdoors. For seniors experiencing dry eyes, wearing wraparound sunglasses outdoors is an effective remedy that can provide much-needed protection from environmental factors that exacerbate dryness. Wind, bright sunlight, and dust can significantly dry out the tear film on the surface of the eyes, leading to irritation, discomfort, and increased evaporation of tears. Wraparound sunglasses are designed to offer full coverage and shield the eyes from these harsh elements, helping to reduce the chances of dry eye symptoms worsening. One of the main benefits of wraparound sunglasses is that they create a barrier around the eyes, preventing wind from directly hitting the eyes and causing the tears to evaporate too quickly. The secure fit of these sunglasses also helps to block out dust, pollen, and other irritants that can enter the eyes and lead to inflammation or discomfort. By keeping the eyes protected from these environmental factors, wraparound sunglasses help maintain a stable tear film and prevent the eyes from becoming dry and irritated. Additionally, many wraparound sunglasses come with UV protection, which is essential for seniors. Prolonged exposure to ultraviolet, UV, rays from the sun can damage the delicate tissues around the eyes, leading to further irritation and dryness. UV protection in sunglasses helps to prevent sun damage and reduce the risk of conditions like cataracts and macular degeneration, which are more common as people age. Wearing wraparound sunglasses outdoors is a simple yet effective way to manage dry eye symptoms. It provides comfort and protection while also promoting long-term eye health. Seniors should consider wearing sunglasses whenever they are outside, especially on windy or bright days, to ensure their eyes remain well protected from environmental stressors. Dry eye syndrome is a common issue for seniors, and its impact on daily life can be profound. As the body ages, various factors contribute to the development and exacerbation of dry eyes, including reduced tear production, environmental factors, and eyelid dysfunction. However, there are numerous effective remedies that seniors can adopt to alleviate discomfort and improve their quality of life. Warm compresses and eyelid hygiene are key remedies that target the root cause of dry eyes by addressing meibomian gland dysfunction and preventing gland blockages. These methods help restore the natural oil layer of the tear film, ensuring tears do not evaporate too quickly. Additionally, incorporating omega-3 fatty acids into the diet can significantly enhance tear production and reduce inflammation, providing long-term relief. Artificial tears or lubricating eye drops offer immediate comfort by supplementing natural tears and keeping the eyes hydrated. Environmental factors like dry indoor air can be managed with the use of humidifiers, which help maintain the moisture balance in the air and prevent tears from evaporating too quickly. Wearing wraparound sunglasses outdoors provides protection from wind, dust, and UV rays, reducing the environmental stressors that can worsen dry eyes. Regular hydration is also crucial, as drinking sufficient water helps maintain overall moisture levels, including in the eyes. Seniors should also pay attention to their daily routines and adopt simple practices, like taking breaks from screens and reading, to reduce eye strain and improve blinking rates. By implementing these natural remedies and making small lifestyle changes, seniors can manage dry eye symptoms more effectively. Consistency is key, as most of these remedies require regular attention to maintain their benefits. With the right approach, seniors can improve their eye comfort, reduce irritation, and enjoy clearer, healthier vision as they age.